In order to deliver the best results after your hip surgery, it is important to pay close attention to the education provided by your occupational therapists.
Over the next few minutes, we will discuss the proper way to perform your daily tasks to make your surgical outcomes as effective and comfortable as possible.
Make sure you select a bath seat that is tall enough to maintain your hip precautions when seated. If you have difficulty stepping over the side of the tub, or if doing so will break your hip precautions, you may need a tub transfer bench. Follow these instructions to safely transfer into the shower using a tub transfer bench. Place bath seat in the tub, facing the faucet. Back up to the tub until you feel the edge of the tub on the back of your knees. Make sure you're in line with the bath seat. Reach back with one hand to the bath seat while leaving one hand securely on your walker. Slowly lower onto the bath seat, keeping your surgical leg straight. Move the walker out of the way, but within reach. If you can safely get into the shower by stepping over the side of the tub, a shower chair should be sufficient. Grab bars will assist with your safety as well, if they are able to be installed. Start by scooting over the end of your bath seat, then lift your legs over the outside of the tub. Scoot to the edge of your bath seat. Push your body up with one hand on the back of the bath seat and one hand on the center of the walker. Gain your balance before grabbing the walker. Move the seat as far back as possible to get into the car, but make sure the front seat is slightly reclined 45 to 50 degrees. Placing a plastic bag on the seat may help you slide as you enter. Back up to the car until you feel it on the back of your legs. Hold onto a secure object in the car, like the seat or the dashboard, and slide your surgical leg straight out. Slowly lower yourself into the seat while watching your head. Lean back as you bring your surgical leg into the car. Bring your legs out one at a time. Lead with your hips and shoulders and do not twist your back. Place your hands on the door jambs for support before sitting down on the passenger side of the seat. Push up to stand and reach for the walker when you are stable. Start by sitting down. Put your surgical leg in first, and then put your non-surgical leg in. Use a reacher or dressing stick to guide the waistband over your foot. Pull pants and underwear up over knees. Stand with your walker in front to pull up your pants. Back yourself up to a chair or bed. Unfasten your pants and let them drop to the floor. Push underwear down to your knees. Lower yourself down, keeping your surgical leg out straight. Take your non-surgical leg out first, and then your surgical leg. A reacher or dressing stick can help you remove your pants from your foot and off the floor. Slide your sock fully onto the sockade, making sure nothing is hanging off the end. Hold the cord and drop the sockade in front of your foot. This is easier to do if the knee is bent. Slip your foot into the sockade. Straighten your knee, point your toe, and pull the sock on. Keep pulling until the sockade pulls out. Make sure you wear sturdy slip-on shoes or shoes with Velcro closures or elastic shoelaces. While sitting or standing, use a reacher, dressing stick, or long-handled shoehorn to slide your shoe in front of your foot. Place the shoehorn inside your shoe against the back of the heel. Lean back as you lift your leg and place your toes into the shoe. Step down into the shoe, sliding your heel down the shoe horn. If you have any other questions or concerns about your daily activities as you heal from your surgery, please reach out to your occupational therapist or your surgeon.